how to know if you're passing kidney stone. Okay, someone asked this question in my last kidney health class recently, and I was so joyous because I've never taken time to answer that question before. So I said I'm going to do a video to address that question properly. So how would you know as a person that you're actually passing kidney stone? Okay, you've been on various treatments, you've taken a lot of capsules, took a lot of teas, a lot of things. So how would you know that you're passing kidney stone? Some people will feel that when they stop feeling pain, it means that the kidney stone is about to pass. No. So these are the things that you're going to notice. So when you're about to pass kidney stone, you're going to experience different signs or different symptoms depending on where the stone is at the moment. So we have different positions that the stone can actually be, but we're going to be talking about the main point. We have the upper pole, we have the middle pole, and we have the lower pole. And if you're listening to me for the first time, I'll be telling you this for free because every other person that have been following me actually knows this. That I used to tell people when you have stone and it's located at the lower pole, that one of the important things you need to do is that you know that that stone is actually very difficult to treat because most of the time it's going to be it needs to be working against gravity. So the best option usually is to operate it and bring it out. But if it is very minute, so you can be asked to be drinking water, to be exercising. So we also have our treatment plan that we can actually give that will help you to help it come out. So if you're interested in that and you're watching this video for the first time, be it on Facebook, on WhatsApp, on Facebook, on YouTube or TikTok, you can actually send a message on the link on the bio on the comment section. So you can actually join our WhatsApp group and join our coaching section. So I can actually show you how you can actually handle kidney stone in that region. So we also have kidney stones at the middle pole and upper pole. Then we have kidney stones that can actually form in the calyces. Okay, the kidney has something that is called calyces. So I'll be doing a video also where I'll be talking about the calyces of the kidney and the chambers and the parts of the kidney, so that we'll be able to understand how this thing works. So now, if you're treating kidney stone and it is passing, maybe either it was in the major callus or the minor callus and we are having pain. So as the kidney stone moves, when it gets to the renal pelvis, you will notice that that pain you are having would reduce or you would not even feel any pain at all. So at that point, some people feel that they've actually passed the stone. Some of them may relax or may stop doing whatever they are doing to treat the kidney stone. That is why I actually advise people, if you're on kidney stone treatment, make sure that at any given point in time you notice any difference in your body, it is better you go for ultrasound scan to know what is happening. You don't just assume, because assumption is the least level of knowledge, and when you apply assumptions to your health, you may not get the best out of it. So when it gets to the pelvis, it may be silent and it may be asymptomatic. So, and it is very dangerous because by then you may stop, you may relapse, stop whatever active exercises you're doing, stop the dieting you're using, the medications, because you feel you are okay. But the danger is that the kidney stone will keep increasing. So, and by the time it keeps increasing, this is where it now gets to the level where it causes what we call PUG obstruction, pelvic urethral junction blockage. So, making it difficult for urine to flow and pass. And this person will now develop what we call hydronephrosis and even hydroureters, and the fluid or urine will start accumulating, and that also is a very big problem. So when the stone is at the pelvis, the person may have less pain, or the person may actually, apart from having less pain, the person may not even feel pain at all. So we also have ureter, the pipe that actually leads from the kidney to the urinary bladder. So if there is kidney stone along that track, as the stone is moving, this person will now experience increased pain. So this person is on treatment. It's not like the treatment is not working. The treatment is working, but because of the movement of the stone trying to come out, this person may experience increased pain. So, and this increased pain should be managed. And another thing is that depends on the size of the stone. The bigger the size of the stone, the more severe the pain is going to be. So if you are having serious pain and the size of the stone is very big, at some point it's better to remove your etheric stone than to try to pass it, because when it is big, because when doing that, this ureter can actually rupture and it become an emergency case. And when something is not done promptly, it can actually affect the life of this person. And worse, if this ureteric stone is in both ureters. So you can imagine when the two ureters are blocked and all the rest of them. So it can actually lead to very serious kidney issues that may actually become irreversible if not if care is not properly instituted. So this is why I tell people, when you are trying to manage yourself, you have kidney stone, you need to meet someone who is actually knowledgeable about the condition you're treating, so that the person will actually give you a guide that can actually help you to become better, to manage yourself better. So one of the things that is going to happen in the ureter is that increased pain. This person may have blood in the urine. Okay, the person may have increased level of blood in the urine, and these are the things that you may actually experience. Remember that when it is in the pelvis, there was no blood, there was minimal pain or no pain at all. So in the ureters, there will be severe pain, and there will be blockage of urine flow, and there will be presence of blood in the urine. So now the next place that the stone lands is in the bladder. So what are you going to be experiencing if the stone lands in the bladder? One of the things you're going to be experiencing is you. It's also a very dicey period when you may experience less pain, depending on the size and the shape of the stone. You may experience less pain, and you also experience fullness and frequency in urination. So sometimes you feel heaviness at your pelvic region. Then you also experience frequency urination. So these are the things that is common with um, um, stones that are in the bladder. So now, when the stone now leaves the bladder and comes to the ureters, the urethra, there's the pipe that actually connects the um, bladder to the exterior, okay, to the either the penis or the urinary meatus outside the distance. So when there's stone blocking the exits of that particular region, look at what happens. There may also be blood, and this time the blood will be fresh. So this person goes to pass urine and is seeing fresh blood. So it could be a sign that there is a stone obstructing. Then this person goes to urinate and the urine is now like it's splashing. Like the urine may now have two um, be like it's scattered, so that could also be, then pain would also be there. So these are the things, these are the things that can actually serially that can happen, and when someone is actually passing stone. And sometimes when the stone is now in the pipe, it may be blocking. You will try to urinate and it will be holding, it will be blocking. So what you need to do in that case, okay, maybe we'll talk about what you need to do in each um, level of passage of kidney stone that we've actually identified in this video. So for you to be able to get that video when I'm going to be posting it, I want you to subscribe to this channel and also click on the notification button so that you'll be able to know when I will be posting that video. Then don't forget, if you have anyone suffering from kidney stone, to tag them to this video. Then ensure, do everything you know you can do to be part of our WhatsApp community, where we share free tips and we get notified about management of kidney stones, and you hear many amazing testimonies of people who have used our treatment plan to crush, dissolve, and flush out kidney stones. I'm Onovo Victory, and I'm your kidney health coach.